All right, now Health Minister Dr. Phaahla has been pushing for all health facilities to be exempted from the ongoing blackouts. The country has been experiencing the longest spell of blackouts, which is currently on stage 6. His Deputy Dr Sibongiseni Dhlomo was in Parliament a short while ago explaining the process to MPs. He joins me now live from Cape Town. Thank you very much, Deputy Minister, for your time here on ENCA. Just tell us, what was the response from Parliament, with regards to asking to be exempted, for health facilities to be exempted from rolling blackouts?
Firstly, thank you very much for this opportunity. The honorable members were unanimous in actually saying, when are we going to get out of the blackouts? Firstly, they supported this move that health facilities should really be exempted, not just a few, but all. But we also reported that we have only 76 of the 213 that we had really prioritized to be exempted. And we would wish that all should be. But however, even those will need some budgets. And all our annual performance plans did not accommodate increasing number of buying diesels. And firstly, like we indicated, we have generators in our facilities, but we do not have generators that can take a capacity that is now being called upon, where a facility that is meant to have a generator to support the ICU theater now has to support the boilers to really warm water for the whole hospital, support the kitchen for 8 hours. So those things are new, and there is no new money. So, but we are very encouraged that there will be a budget presentation tomorrow by our minister, and already these solar panels that we have really been discussing, the CSIR as a department will probably kick in terms of finishing that process. Hopefully, the report will be tabled to the Minister of Finance by April, with the understanding that if we are successful, maybe by June, countrywide, we may then be also having a solar system in place in hospitals. But over and above that, there are 46 other hospitals, 46 other hospitals that we would wish there could be prioritized. However, there's a pressure that, like, I could give you Khayelitsha Hospital, for example, Polokwane hospitals. You can't exempt them until and unless you actually separate the grid, the line that goes to the hospital from the rest of the community around it. So those are other things that are being looked into, and that we are actually going to find our monies. We are going to look into the budget to get those things attended to.
Speaking about the budget tomorrow, what are you hoping for as the health department? I mean, for instance, last year you did ask the Ministry of Finance for more money. Did you get that money? What are you hoping for tomorrow?
Look, the National Treasury will also expect competent plans from us. We hope that the plans that have been put together by our CFOs in a platform called CFOs Forum of all provinces, Department of Health, is credible enough to really have a weighting, because this has really affected the quality of service that we give. Like I'm saying, we've always had generators, but those generators were to give just a backup support in the event there's an electric trip for 2 minutes, 10 minutes, and 30 minutes, not to really support us for 4 hours when there's no electricity, because suddenly we even lose having water being pumped into our reservoirs in our hospitals if we do not have electricity. Now, we have presented that case, and probably the Treasury is going to look into it positively. We do not expect that they have all the monies, because there are other government pressures. So we think there would be a slice of some resources that will be allocated to health, just to kickstart and actually augment the energy crisis that we are facing in our hospitals.
And, Deputy Minister, you talk about, for instance, diesel expenditure that has obviously gone up at some of these hospitals because of, the rolling blackouts that we've been experiencing at the moment. But I want to know, in terms of lives lost or procedures that have had to be halted as a result of blackouts, how's that looking?
Yeah, you are correct. Let me start on the diesel. on average, you have 1,000 liters of diesel that lasts you 5 days in a hospital under normal conditions, if there's a queue. But now, 1,000 liters of diesel takes you 2 days because of these pressures that we have. So that new money is not there. We didn't budget for more diesel. Number two, that generator again, which kicks in almost every day for 4 hours, has actually increased the budget for maintenance and for services. And all those costs are now new items that we must table in them. We are actually saying, yes, we are noticing was, for example, we're just getting a report even from provinces. In Nkosi Albert Luthuli Hospital, for example, has got 15 theaters where you can, at all of them, be functioning optimally every day. So 15 every day you can be functioning there. But because of load shedding, you then decrease, because whatever you get as a support in the supply must take care of this quantity. You have about 4 theaters up and running most of the time. So then you increase the backlog of patients who otherwise were to be operated today, but to be operated tomorrow, or then deal with the emergencies mainly, and elective cases are then left behind. And the backlogs in surgical cases has actually been noticed to be increased in various provinces. And we are actually saying that is our case that we are putting forward to say we would want to decrease the number of surgical backlogs, among other things, improve our functionality in hospitals, improve water supply and all that. So we would need some additional monies and resources to do that. So that is what we are tabling, and we have tabled at the Department of Health under the leadership of Minister Phaahla to the National Treasury.
Yeah, that's what I was going to ask you, actually, because the Department of Health is one of the 2 departments that usually gets the highest stake during budget, yourselves and the Department of Basic Education. So obviously, you're one of those departments that will not be able to have any money taken away from you.
Obviously, I always maybe make this to say, if a student were not to do well this year because there was not enough resource to support, that student might get a chance to come back next year, but we don't anticipate that should be a routine. But for us in health, we don't have that luxury. If we do not have resources to save this life today, this year, we may not get a chance to save that life next year. So our issues are even more critical in health than anywhere else, because it is about saving lives and making sure that people live at least longer than what would have happened under the normal conditions.